The reason I chose Dr. Laverson after seeing about 4 or 5 doctors was because of his basically bedside manner. He was very informative. He answered all my questions. He didn't say, oh, and by the way, this should be done and that should be done. He looked at what my expectations were, and he just was very informative.
People don't come in for surgery. They generally come in to look better. And surgery is the bad part. It's the downside, and we look at our job to minimize the downside, their fears, their apprehension. We inform them.
At my consultation, I was very impressed with how he listened to me on what I wanted and the results that I was looking for. He really listened, and he took his time and gave me a great consultation explanation of what he wanted to do, what he thought should be done. I just felt like he really, really cared.
Surgery is safe these days. Anesthesia is safe. We use a safe surgery center, and really we try to get them through the surgery with the end goal in mind, which is to look better. We try and make it as comfortable as possible and really answer all their questions and make sure they're fully informed before making a decision.
When I came into Dr. Laverson and told him what procedure I was interested in, he sat down with me, he talked to me about it, told me everything that would happen from that moment on till recovery, and really put my mind at ease on a lot of questions that I had that other doctors weren't willing to tell me about. And I feel that he was the best man for the job in my case.
I'm only as good as the result on my next patient or the patient that I'm taking care of at that moment. And even though I've done many, many procedures, and we do this every day, I can't let it get routine. For that individual patient, that's the only chance that I have to get them a great result. So I really do spend the necessary time. Attention to detail is important, and you know, I sort of, when I get into the operating room, I don't pay attention to time. I really try and focus on the details to try and achieve the best result possible.
It really helped my self-esteem. It made me feel not like a grandma. So I just feel, I feel good. You know, he was just made me feel like young and youthful, and I just feel great, actually.
We really try to meet everybody's needs, and we're versatile. We're experienced in many different types of procedures, and again, we adapt the procedure to the patient rather than doing one procedure on everybody, because again, everyone's unique, and we feel like to get the best result for an individual, really you need to be adaptable, and of course we want it to be safe and get the highest quality results, so we do hold ourselves to high standards.
He was very tedious and technical, and I expressed my fears of my scar I was going to have, and he showed me exactly where it was going to be. He said, I'm going to do the best job, and the first thing I heard when I came out of surgery was the nurse said to me, you have a great doctor. He took such good care of you.
And he is very professional, very good at what he does, and his patients love him.
Well, Dr. Laverson has saved my life. I was infected with necrotizing fasciitis in 1998, and actually I met Dr. Laverson when I woke up from being in a coma for 30 days, and met the man who saved my life. You know, he just never gave up on me. He was wonderful with my family, and you know, you just couldn't be in better hands. I don't know what else to tell you. You know, not only is he a great doctor, he's a great human being.
I felt that he really cares about his patients. He took his time and listened to my needs, and I felt that he was sincere, and at that point I made my decision to use him.
It's very important to understand what sort of standard the surgeon holds himself to, because if he holds himself to a very high standard, then the chances are he's got high standards for your safety and your result.
I was referred by a friend who just said, you have to use this guy. He consistently cares at your consultation, at your operation, your aftercare. All three needs were met and result.
He is really down to earth, and he's wholesome, he's thorough. I mean, there is so many adjectives that can explain and express what Dr. Laverson does.
He's really honest. He tells you what to expect, even if that's not what you want to hear. And my results were actually more than what I expected. Made my outside feel as young as my inside. So I feel like I look good, and it's really helped my self-esteem in all aspects around my husband, and just everything. My outside matches my inside now, I think.
That's why we do this. That's what motivates us in this enterprise is the changes we see in our patients, mostly psychologically, because, as I said, people don't come in for surgery. They come in to look better, and the reason they want to look better is so they can feel better about a certain feature that may be bothering them, that they wish to improve. And these days, there are many things we can do that we weren't able to do in the past. So if I'll operate on somebody, get a successful result, they come in, they feel better, maybe it'll lead to them getting engaged, they feel more comfortable in social and professional situations, and they progress and sort of expand. And for somebody who's been held back or embarrassed by a certain feature, or feeling insecure, or doesn't feel good about a certain feature, you really do see a psychological difference, and they're very grateful. That's really the most gratifying thing about doing what I do.
I recommend Dr. Laverson to everybody. Everybody that asks me. I'm really not quiet about my plastic surgery, so everyone at the gym where I go knows. So I always say, oh, you need to go to Dr. Laverson. He's the best.